Hey everyone, my name is Jess and welcome back. We've made it to the final episode of the Lewisham Youth Brain Health Radio Show. We've been trying all things brain health and dementia, and we make it simple to get. Last time, Miguel and Jermaine spoke to Kritika about how to keep our brain healthy, so check it out if you missed it. I'm a part of the Lewisham Youth Brain Health Champions, so this show is brought to you by us. Shout out to Miguel, Jermaine, Bonnie, Harley, Henry and Paul. We have an exciting show today. We're hearing from the Youth Brain Health Champion about the episodes. We will catch up with Dr. Kritika about her job as a dementia researcher, and we'll also be chatting to Catherine about what's happening in Lewisham when it comes to young people, brain health and dementia. Let's say hello to our guests.
Hello.
Hi.
Hi, it's so nice to have you guys here in the studio. But before we get into the show, for anyone new listening, Kritika, could you please explain what dementia is?
Yes, of course. So dementia is essentially a disease of the brain. It's when the brain starts getting old. So it doesn't work as it really should be doing. And usually this manifests as symptoms like memory problems, forgetfulness, and confusion.
Thanks, Kritika. Please continue listening and we'll hear more from Kritika and Catherine later. We usually have a quiz after intros, but we are changing things up this episode. Since it's the last episode, we'll be hearing from the champions about each one. First, Paul and Henry from the first episode. They talked about what dementia is. Can you tell us why you decided to become Lewisham Youth Brain Health Champions?
So personally, I decided to become a youth brain health champion just because I feel like with me dealing with mental health, I feel like it's probably best for me to aid others when it comes to mental health, when it comes to brain health, when it comes to dementia. Additionally, I also want to dabble in some research in brain health and dementia just because I have a deep soft spot for dementia and brain health. So yeah, I just found this a great opportunity to not only show my expertise in the brain but also to aid others who are also suffering with their brain health or dementia.
Hello there. I'm just really passionate about, well-being in general, and I feel like this is like the perfect medium to get young people to actually care about their mental health. And as we know, we're living like an increasingly digital age, and I feel like that comes with the side effect of young people, not really caring about their mental health or their brain health in general in the way that should actually make sense. And so just the fact that I was able to actually run a radio show that encourages people to actually care about themselves more is something I'm just, really glad I did.
Thank you so much for your insightful and personal responses. But what is the main thing you want people to take away from your episode?
Honestly, it's just, straight to the point. I just mean, take care of yourself. Your brain is probably the most vital organ you have in your body. And that should make sense, but unfortunately, not a lot of people know that. So, you gotta eat your vegetables, you gotta stay in bed as much as you should, get involved in brain stimulating activities, and don't be on your phone that much, you know what I'm saying?
Echoing what Henry just said, brain health is really important, and with a lot of people going around spreading different stereotypes around the brain, it's kind of odds that not a lot of people know about the brain. And I feel like us as the youth brain health champions is probably best for us to kind of spread awareness around the brain. And given that the brain is extremely delicate and that we need to look after it, it's just really important that we have to spread awareness about the brain. Is extremely important for us since we can't really have another brain. We can't have a brain transplant, so it's only suitable for us to take care of our brain. As Henry said, we have to sleep well. We have to eat the right kind of fruits and vegetables. We have to have the right nutrition, and overall, just try and keep our brains healthy.
Thank you so much for your responses. Now we have Bonnie and Harley from episode 2. They talked about what it's like living with dementia and how it affects people. What made you want to become Lewisham Youth Health Brain Champions?
I heard about the project through Young Advisors, and I thought it'd be really interesting for me because over the last couple months my granddad started to show signs of dementia, and I wanted to learn more about it to help our family and stuff.
For me, I wanted to look at it from more of like a scientific and research point of view because I'm really into science. And I didn't really know much about dementia before, even though I do have a couple of family members who suffers from it. So this was just a really good way to like learn about the research process and putting together a radio show and just learning more about dementia.
Those are both very interesting perspectives. And what is one main big message you want people to take away from your episode?
The main message I want people to take from my episode is that if you take care of your brain health now, it will take care of you later.
And the next message that I want people to take away from our episode is that even if you do develop dementia, your life isn't over. Obviously, with Pete, he has dementia and he still lives a very fulfilled life. So it's not the end of the world if you get it.
Thank you both so much for your responses. Now over to Miguel and Jermaine. They did the last episode about keeping your brain healthy and preventing dementia. Why did you decide to get involved as Lewisham Youth Brain Health Champions?
Because my grandma, she had dementia, and I just want to know more about dementia because, you know, like, I have seen in like many shows and movies like how they show dementia is like in a very significant way.
I decided to be here because it just seems overall pretty fun to educate everybody around the borough on how to keep your brain healthy, everything about the brain and misconceptions that we need to debunk. On an overall basis, once everybody is able to learn these things, everybody will have a healthier brain health and will be able to keep living longer, living more fulfilling lives with their friends and family.
And what is the biggest thing you want listeners to take away from your episode?
So for me, I feel like your brain keeps you alive, so it's best to keep it healthy after all.
I want listeners to like realize like the impact of dementia and how it could affect even your age. Like it can affect anybody, and it can just like, you know, it just affects people. And I want young people to know like all the things that you should do to keep your brain more healthier than you usually are. Thank you.
Thank you to the Lewisham Youth Brain Health Champions for sharing your experiences with us. Next up, we are speaking to Kritika about her career path and what working in dementia is like. Hey Kritika, welcome to the show. How are you doing?
I'm fine, thank you. I'm very happy to be here today.
We're really lucky to have you as well. Thank you for joining our show. So to kick off, can you tell us a bit more about what you do?
Yes, of course. So I am a dementia researcher at King's College London, and the work I do is essentially looking at how people living with dementia and family carers can be better supported. So this is in terms of what services they need, how they can access it, and how people can get the best care for the best quality of life for their loved one with dementia, but even for them as a family carer. I also look at how workforces that support people with dementia can be looked after. So this is staff who work in either care homes or in home care. And exactly like Bonnie said, I do think having dementia is not as much doom and gloom as people think it could be. There is a lot that can still be retained and quality of life can be enhanced. So it is really just making sure that the right supports are put in place so that people living with dementia and family carers can get the best care possible. And that's what I research.
That sounds very interesting. What does a fun or exciting day at work look like for you?
So I have lots of days where it's a lot of emails and meetings and admin, but today was a very fun and exciting day because it's actually Dementia Awareness Week. And just up the road from here in Catford, there's a Stansted Lodge, which is this lovely community centre. And we had this event, which was a public engagement event for people with dementia and family carers in the community. And we were raising the awareness of dementia and telling people about the local services in South London. And I find events like that really, really beneficial. You get to see how people access services, what is missing in the care that they want, how they respond to the services that are out there, whether they think some things are good or not, and why that could be. And that for me is one of my fun and exciting days, when you actually reach the communities that we want to do when we're doing the research in an office usually.
That sounds really, really cool. And how did you get into this career? Did you have to study certain subjects at school or go to certain schools?
So I did my degree in psychology, and then I went on to do my master's in a topic called gerontology, which is essentially the study of older people. And then I did my PhD for a good 5 to 7 years in dementia and quality of life. Now, I know that sounds like a lot of studying, but it is essentially just doing research and studying a topic in a lot of depth. So I really, really enjoyed that because that became my career. So it was lovely to do a topic and researching it in as much detail as I did for my PhD. And that's how I got into the career that I'm in. I think going to top colleges is helpful, but I also think you can do that in any university. And just being passionate about what you want to do will make you successful and happy in the work that you do after.
That must have taken a lot of hard work. Anyways, what inspired you to become a dementia researcher and stay in your career?
So I've always been interested in older people and how people age, why some people get dementia, why some people don't. And as I did my research for my PhD, I found that that while people lose memories and get forgetful when you get dementia, there is a lot that remains. People stay the same person, they have the same likes and dislikes. So my entire passion in staying as a dementia research was, how can we keep enhancing that? How can people be given the right care so that they remain themselves for as long as possible? How can their preferences be retained for as long as possible when they have dementia? And that's why I continue to be a dementia researcher. But I also realized that looking after someone with dementia is hard work. So a lot of my work now goes into supporting family carers that look after people with dementia and supporting the workforces that look after people with dementia. I hope that answers your question.
It does, thank you. And for my last question, what advice would you give to a young person listening to this show who wants to work in brain health or dementia?
So one of the things I think we forget is that volunteering is such a lovely little option for people who may have a spare hour once a week, and there are day centers or community clubs and community organizations that work for people with dementia. So there are dementia cafes or memory cafes or day centers where someone can volunteer to see whether you actually want to work in dementia care or whether you want to work in dementia research. So if it's dementia research, I would really strongly encourage people to reach out to a researcher whose work they've read about, or if you even just Google a dementia researcher in a local university or college that is local to your area. People are willing to want to talk to young people, especially young people who are passionate about brain health and dementia. Is so fascinating for academics and researchers like myself. So if I got an email from any of you saying you're interested in doing more work, I think that would be an excellent opportunity to form a bond there. So if someone is interested in brain health and dementia, think about volunteering and definitely have the confidence to reach out to a researcher you might want to talk to in a bit more detail.
I'm sure many young people will benefit from your response. So that's all the time we have for. Kritika, it's great having you on. Thank you so much. I'm sure you've inspired lots of people listening. Anyways, let's bring in Catherine. Hey y'all, how you doing?
I'm very well, thank you. Lovely to be here.
It's lovely to have you. Could you tell us a little bit more about you?
Yes, so interesting things about me. I was born in South London, not quite Lewisham, Southwest London. I have lived in London my whole life. I have West African heritage. My parents are from Ghana. And I am also the Director of Public Health for Lewisham, based in Lewisham Council.
How does your job connect with brain health, dementia in young people?
So my job is all about prevention. So that means keeping people well and healthy as possible and preventing them from becoming ill in the first place. So I would say that lots of the things that we do and try to encourage and support people to live healthy lives prevents many illnesses, including dementia, heart disease, respiratory disease, etc. So lots of the work I do is about preventing ill health, including dementia.
That's really, really interesting. Is information about brain health and dementia being shared with young people in Lewisham?
Yeah, I don't think it's being shared enough, I would say. I think the job that you're doing here with Kritika and the team is amazing. And I think it's going to just put a new conversation out there about brain health, about how young people can be as healthy as possible. So I think we've got a lot to do with public health, but you guys are doing a great job on our behalf, I would say.
Thank you. But may I just ask, why is information about brain health and dementia not being shared with young people?
Yeah, I think probably an oversight. I would say we focus a lot on things like helping you have a healthy diet, helping you be physically active, those type of things, but we don't talk about the illnesses that you may get later on in life. So I think we do much more, we call it upstream, so much of that prevention type stuff, and we don't talk about brain health or dementia. So I think, we've got to do a better job at that, I think.
Well, is the council doing anything to improve people's brain health and prevent dementia in our local community?
Yes, I would say we are. So we have, all areas in the country have something called the NHS Health Checks programme, and that's for adults largely. So for those aged between 40 and 74, every 5 years, if you don't already have a heart disease or an illness like that, you're invited for a check. So we check your cholesterol levels, we check your blood sugar, we ask you how much exercise you're doing, what you're eating, and then we produce what we call a risk score for how likely it is that you will develop heart disease in the future. And if that's a high risk score, we try to advise you on how you can be more healthy, how you can eat more healthily, take more exercise. If you smoke, how you can stop smoking. If you drink alcohol, how you can reduce the amount of alcohol that you drink. And that all supports reducing the risk of heart disease, including dementia later on down the line.
Well, it is like really good work that the council is doing, but I think there is still a long way for us to go. Thank you for joining us on our radio show. It's been so interesting to hear about what is being done in Lewisham when it comes to brain health and dementia for young people. Now it's time for the youth voice part of the episode. This is when we get to hear from you, young people in Lewisham. We asked, what do you want to see happen in the future to help young people have healthier brains? This is what you had to say.
I would like it to be taught in school more, like how to look after your mental health, and just to have a better understanding of what you can do to like improve your brain health and stuff.
I'd say for young people to get educated about how to take care of themselves properly, especially living with mental health these days, and just like the modern world, it can be like very distracting, and sometimes you just need like some support on how to take care of your brain.
I think just to raise awareness, like what you're doing now about dementia, really help.
Maybe more social activities that were like groups with youth so that they can all connect and all stay with mental health.
I think in the future I want more organisation or campaigns about this, because until today I wasn't really like as aware, but I want more people to be able to understand how effective your brain is and that care.
I think assemblies and primary schools, secondary schools, people going up and down the country just to sort of make young children more aware of how to protect their brain health and how to improve their brain health so that we can decrease the chances of people getting dementia and people that are affected by dementia.
I think more or less more adverts. I feel like because nowadays most teens and adolescents are on social media, so I think showing more stuff like that on social media might influence them more to make a change in their life before it's too late.
In the future, I would like to have people with the field of dementia for helping young children if they have that condition.
I think to help young people have a healthier brain, I think young people should be supported in schools, more youth clubs to be made, just engaging with the young people and doing stuff they like to make sure they're not doing anything like illegal, like smoking, because that messes up your brain. Just engaging yourself.
I'd like to see more people learning about brain health from a younger age, like in schools. It would be very cool if there were more activities that helped with memory, focus and stress, kind of like brain workouts. I also think people should talk more openly about stuff like dementia, so it's not misunderstood or stereotyped.
So, Catherine, Kritika, what did you think of what the young people shared?
Yeah, I think it's great. I like the idea of brain workouts. I like the idea of going into schools and talking at assemblies. So getting in there as early as possible to talk about the importance of brain health.
Yeah, I agree. I'm impressed by all the ideas people have. And exactly like Catherine said, I think the idea of going into schools is really interesting and important because I think, like all of this work has shown, it's never too early to talk about these things.
I agree. Thank you to everyone who shared their thoughts. It was great to hear. And that is a wrap for the Lewisham Youth Brain Health Champion radio show. We've learnt so much about brain health and dementia throughout the episodes. But this is the last of the episodes, but it's not the end of the conversation. We will be out and about chatting to young people in Lewisham about brain health and dementia. You might even see us in your school or youth club. Thanks to Kritika and Catherine for joining us today. If you want to listen to the episodes from the show, visit the Youth Involvement and Engagement Lab YouTube channel. This show is brought to you by the Lewisham Youth Brain Health Champions Programme. It is being coordinated by the Youth Involvement and Engagement Lab, the Lewisham Young Advisors, the Spin Dementia Network Plus. It is funded by the Alzheimer's Research UK Inspire Fund and being recorded at Radio Lewisham. Thank you.